I wonder if you could talk just a little bit about your views on healthcare, Helena. I know it's a really important issue to a lot of voters in your district. We know that the healthcare system affects everybody, even if indirectly, almost everybody either is personally affected by a lack of access to healthcare or knows someone who is or might be affected or might be vulnerable. So can you talk a little bit about that and whether there are any differences between you and your opponent when it comes to
Yeah, so my opponent's votes on healthcare, state healthcare, which is Medicaid, have been consistently to try to reduce care for citizens who are on that healthcare. And I want to talk a little bit about what that Medicaid pays for. A lot of people think it just pays for poor people in the city. I don't know what they think, but it doesn't. It actually, most of the money goes to seniors and to the disabled. And then another portion of the money goes to children. And lastly, pregnant women. And the current thinking behind our medical care is give these pregnant women as little care as possible until they have the baby, and then cut them off of care as soon as possible. Now, there have been improvements on that, and I'm not gonna, and I think that my opponent may have voted to expand that time. I'm gonna be fair, I think he may have voted for that. But he's also voting for work requirements to make people eligible for aid. And most people don't realize how poor you really have to be to qualify for Medicaid in Missouri. It's low. You are living in true poverty if you qualify. And if you get a full-time job at minimum wage, you very quickly are no longer eligible. So the work requirement is kind of like a catch-22. If you stay unemployed, you can stay on the system, but if you actually get out there and get a job, you're punished by losing your benefits. And they call, I think that's called the cliff, or the Medicaid cliff, or something along those lines. But the GOP attitude has really painted them into a corner where now they're kicking people off of aid who are truly, truly poor with children. And I think that obviously we need to fix the system. And what a lot of people also don't realize, and what I've learned as I've done research on this, is that, when people go to the hospital or the doctor and they don't have insurance and they cannot pay the bill, that cost gets shifted onto those of us who do have insurance and do pay our bills. So we're paying for their care in any case. It's a cost shift. It is pretty direct. I talked to somebody from one of the health insurance companies in 2018, and she let me know, which I didn't know, that the hospitals and the doctors, they renegotiate with the insurance companies for their reimbursements every year. And what goes into that consideration? The amount of bills that have not been paid, the amount of money they have to recoup, the amount of money they expect not to get paid by emergency room visits. And preventative care really goes a long way to save money. If you have somebody who has early stage diabetes, early diabetes, COPD, anything that can keep those people healthy and on their medication long term, regardless of whether they have money or not, keeps the system more efficient. And the governor actually he requested a report. He paid for a report by the McKinsey group, the consultants, and to evaluate Missouri's healthcare system. And they came back with a number of observations, which I'll summarize as: politicians don't understand the situation. They don't really know how healthcare works. They are not doing a good job of managing this, and that giving people more continuous care so that they can stay healthy will reduce costs. And if we have a value-based system instead of fee-for-service, we get better outcomes, a more productive society, and we lower costs for all of us across the state. And the idea that we're not willing to entertain that idea, the idea that we can't open our minds to a better way, when clearly what we're doing is not working. it doesn't actually, we haven't really cut the budget that much. We haven't really made people well. We haven't really solved any of the problems that we're faced with. We're just kind of, limping along with the same broken system and trying to band-aid it instead of actually heal it.